everybody. Welcome to another episode of Wellness Day, a podcast coming to every Wednesday here at the Jehangir Wellness Center, the JWC studio. And today, as you can see, is a very special episode. We're celebrating Christmas with you. So we hope that you're having a lovely Christmas season. And today's episode, I've got a bone to pick with Dr. Anuradha Khadilkar. She is actually going to be talking to us about a very specific aspect of wellness, and that is bone health. So thank you very much for being with us today, Doctor.
Thank you so much, Cowasji, and thank you for inviting me. Thank you to the whole team.
And happy Christmas to you.
Thank you to everybody who's watching the podcast. A very happy Christmas.
Thank you. So today what we're actually going to be talking about, as I said, is going to be talking about bone health, which is something that is a very specific thing that people don't think about. You know, it's the thing that is what we talked about earlier, is something called the silent killer or the silent disorder.
Yeah.
So just quickly, if you can just tell us in a brief, what is bone health?
Yes, so a lot of us know about or may have heard of something called osteoporosis.
Right.
So essentially this means that your bones are weak. Mm-hmm. If you have osteoporosis, means your bones are weak. And this is something that actually happens as people grow older, more so in women, because you know the hormone in a woman's body which actually keeps up the bone health is estrogen. And once that is lost, that is after menopause, then actually women's bones get quite weak. Like a lot of other stuff, like you must be knowing, or somebody else must have come on a podcast and spoken about it, that diabetes is commoner in Indians than it is in people of other ethnic races. Similarly, so is osteoporosis.
Oh, is that so?
Yeah.
So why is that?
Maybe it's just the ethnicity. So, you know, like some of the people who have the strongest bones and possibly some of the least calcium intake are the Africans. And they have the best bones. They have the best bones.
That's
so
quite inversely how you would think about it, because everyone thinks calcium, bone health.
But calcium is not the only nutrient.
Okay.
There are other things which you need for good bone health. One is, of course, protein.
Right.
And as you know, a lot of the Indian diet is very high carbohydrate diet and low in protein. And the protein is
It's a vegetarian diet.
Yes,
mostly.
that's right. More vegetarian. Another thing is the sunlight. So I think what the Africans are possibly benefiting from, because they're on the equator, is a lot of vitamin D.
Right.
So you need vitamin D, you need good calcium intake, you need exercise, and you need protein.
So how do we get that here in India, if that's a struggle?
So as far as the sunlight is concerned, we are blessed by the sun. But
sometimes too blessed.
Yeah, but we don't go out enough. So, in fact, vitamin D deficiency is so common. I mean, that is the reason why I got interested in bone health to begin with.
And you actually do it more from a research standpoint. So, actually, that's why interesting talking to you, because we're talking more from a population standpoint as opposed to individuals, which can be applicable to the individual.
Yeah, what you say is right, but I think I can say I do both.
Right, of course.
So we've been running a DEXA, or the bone densitometer, in Jehangir Hospital. So essentially, you need a bone densitometer to diagnose osteoporosis.
What does that tell you, basically?
Yeah, so it tells you how much calcium is there in your bones.
Okay.
And it will also give you a score which will tell you how much prone you are to fractures.
Oh, I see.
Yeah.
Okay.
So, and you know, one of the reasons why, like I said, I'm interested is because there's a lot of vitamin D deficiency in India, because we don't go out in the sun enough, and there's this big thing about fairness. So basically, sunblock, while it is good, it prevents aging, but vitamin D gives you life, you know. It's a very, very important hormone which is made only if you are out in the sun. So, you know, less exposure to vitamin D is something that is there in Indians, apart from our own propensity for osteoporosis. So, in fact, you know, Indians get osteoporosis 10 to 20 years earlier.
Second thing, much earlier?
Yes.
Wow.
So, you know, 1 in 3 women and 1 in 5, or between 1 in 5 to 1 in 8 men above 50 years actually have either osteoporosis or penia, which means they have weak bones.
Okay.
So that's a very high number.
Right.
And the thing is that, you know, now India at the moment, what the numbers say is we have around 10% of elderly population. But this is going to be 20% in 2050.
Yeah.
So as the population ages, so does the problem of osteoporosis.
Right. But coming back to the point that you were making about this fracture number or your susceptibility to actually having a fracture, how can one improve that? What are the main things that I mean, we talked about it, we're talking about vitamin D and calcium and things like that. But what are things that we can do to actually improve that score? And have you seen that happening with people?
Yeah, I have. So, first I'll just say that basically bone is a tissue which functions at its own pace.
Okay.
So, if you had anemia and I gave you iron, within 3 months, you would at least your hemoglobin would come up.
Okay.
But the bones are much slower than that. They lose slowly and they, put away bones slowly. So it takes time to recover from osteoporosis. Hence, prevention is good. So if you look at healthy bones, I'd like to start in children because, as you know, primarily I'm a pediatrician.
Right.
So we all are aware that, children grow first in the first 3 to 5 years of life and then again at puberty. So puberty is around 9 to 15 years in girls and around 12 to 16 years in boys. Later, as always, in men.
Yeah.
But, that is the time you need to make sure that your children are having enough calcium,
Right.
enough vitamin D, and playing well and enough protein.
What does playing well mean?
So, playing well has been described by the World Health Organization as 60 minutes per day of vigorous activity for children. Yeah.
That's a good amount.
That's a good amount. Exactly. That's a good amount. A lot of us don't pay attention to, all of us are chasing these classes and schools and this and that. While that is very important, it's very important that every child plays for 60 minutes a day. And by vigorous, we mean the child should be sweating at the end of it.
Yeah, absolutely. Because as you said, everyone is focused on the academics and things like that. We forget about this aspect and you're missing the woods for the trees.
Absolutely.
Also the tree for the woods. But you know what I mean.
I know what you mean, and I'm sure the people who are listening to us also do.
Yeah.
So in childhood, put away as much bone as you can. That is called your bone account. So you can go from 2 kilos to a quarter to 2 kilos, but you can't do 2.5. So after around 25, you can't put away any more bone. So you.
What do you mean by put away bone? You mean
That
bone
is
strength or your
no.
bone
I
becomes
mean the
bigger,
amount
or?
of calcium.
Oh, I see. Okay.
Yeah, but also the bone becomes bigger. So, a thicker bone is a stronger bone. Mineralized bone, a bone with lots of calcium is the stronger bone. So, in childhood and up to, roughly the third decade, make sure that there's plenty of calcium in the diet. As I said, 60 minutes per day of exercise for children. And as adults, you need enough calcium in the diet, which is anywhere between 800 to 1200 milligrams per day. You need
But
exercise.
can you get that through food or?
Yes, you can. I mean, it's a little difficult because we as Indians don't have too much milk as adults, But I guess once, especially after menopause, you almost always need a supplement.
Okay.
Only a word of caution is for those people who form stones. For them, it is best to get a doctor's advice. I mean, for all this, don't take anything that we are just saying. You have to take your doctor's advice.
Of course.
But
Like, for example, they say that for stones, you should be having beer.
I wouldn't know about that. I'm not very good at that. But I'll take your word for it. So, in postmenopausal women, you need around 1200 milligrams, which is very hard to get from the diet. So, enough calcium. 150 minutes of physical activity per week, which means around 30 minutes a day.
That's not too bad.
Not at all.
Manageable.
Yeah. Next thing you need is a bit of strength training. So if you actually go swimming, that is not as good as an exercise as you would go walking. If you walk with a bit of weights, it is even better.
No, I completely agree with you. I had another episode with Dr. Radhika, and we were talking about the importance of exercise and muscle strength over there, because how that ties in to bone health.
Yes. So you're absolutely correct. So weak muscles is actually called as sarcopenia.
Right.
And
that's the sort of decay of muscles.
Yes. And it's more because we tend not to use our muscles as we grow older. So, it's very important to continue to do your things yourself.
Right.
So get enough calcium, keep your muscles strong, because the muscles will pull on the bones and get them to be strong. Weight-bearing exercise, vitamin D. being out in the sun, if you're not out in the sun. So actually, as you grow older, your ability to make vitamin D, because our best source of vitamin D is the sunlight, but your ability goes down as you grow older. So you actually need a supplement. So vitamin D and calcium supplements as you grow older, and a good protein intake.
Absolutely. But yeah, I can't emphasize the exercise aspect enough in terms of the muscle retaining. When we were talking about that, there was a stark sort of example that we were talking about is that, for example, if someone at the age of 40 can lift something like 100 kilos, which I mentioned I could do quite easily.
That's quite something, actually. Yeah, excellent.
But the point is that if they were to stop at the age of 40 doing any kind of strength training, if they could do 100 at the age of 40, and if they stop then, by the time that they're 80, they can only manage about 10 or 15, which is a very stark drop off.
What you say is right, but one has to kind of be sensible. You know,
of course. I'm assuming I'm assuming that if you had a sedentary lifestyle, and that's which is my point, is that you can't stop exercising.
And don't be sedentary.
Yeah, exactly.
So everyone says that sitting is the new smoking. So do not be sitting all the time. So if you're sitting all the time, it's not good for your muscles.
So people who are actually sitting and smoking is like a double whammy.
Absolutely. And actually, there's one more thing in all this. That being that, because as Indians and because of the type of diet we have, practically every second or third person has dyslipidemia, which is, higher cholesterols, or second or third person actually has diabetes. And all these chronic disorders also affect your bone.
Yeah.
So, you have uncontrolled diabetes and you have high lipids, your bones are going to be poor.
Yeah. So it all ties in, pretty much everything into your lifestyle. So let me ask you a question, Doc, particularly for children, and since we're talking about Christmas, might be a tough one to answer. But if Santa Claus had to gift children something in terms of bone health, what would be that one thing?
I'd say a good diet and loving parents, plenty of exercise.
That's good. That's something that one can hope everyone gets.
Yeah, because actually, unlike in adults, if a child is not growing properly or is growing poorly or is failing in growth, it's also sometimes possible that the child is unhappy.
Exactly. That comes back to another aspect of, mental and emotional well-being, and that ties into wellness over here. Yeah. Absolutely. Yeah. So, final question. Just quick myths that we want to talk about, that we want to get rid of, that people have in terms of bone health.
Yeah.
What are the typical common ones that come to you and that would like to?
So I think the commonest one that I face is that, I had my blood calcium levels done and they were normal.
Right.
So why do I need a bone density done? So the answer for that is actually calcium is essential for life. So what happens is, if you have less calcium, then if you're eating less calcium, then your bones will be leached of calcium by a hormone called PTH. And so your bone density will go down at the expense of your calcium levels being normal. Okay. So blood calcium is not an indicator of what your bone health is like, because the bone is a reservoir of calcium in the body.
It's only one leg of a stool.
Yes. Very well said.
Right.
The second myth is, people think that the DEXA scan is like one of the other scans where it is very high radiation, or, that it is painful, it takes a lot of time.
It's quite peaceful, actually. I've done it a few times.
Yes. So the radiation is very, very low. It's just about as much as you would get on Pune or any other Indian roads.
Right.
So it's negligible.
With a lot less stress.
Yes. And especially if you come to the wellness center here, it's extremely peaceful.
Well, absolutely.
Very peacefully, you can have your DEXA scan done. You can get your DEXA scan report very quickly, and but you need a scan to be able to tell you whether the bone density is normal or not.
Got it.
Yeah.
Okay. Well, thank you so much for your time and giving us these insights into bone health, which we started off by saying is the silent disorder. So I'm glad that we could bring that out and make it less silent today. So thank you very much for being here.
Thank you. And I'm going to put this
and
on.
Join me, please, in wishing everyone a very Merry Christmas again. Well, thank you so much.
Merry Christmas,
Merry
everyone.
Christmas, everyone, and have a great, great New Year. Thank you, and join us for the next episode.